Few things in this world are more precious than the beginnings of a new life. Moments of pristine perfection, the promise of a lifetime yet unlived, a miracle we can hold. These newborns are truly our tiniest treasures. But what happens when things aren't so perfect? When babies are born too soon? When tiny souls cling to life as unease replaces hope in the hearts of parents?
I had a C-section. It was a very scary experience. We really didn't know what was going to happen.
Meet Dave and Mindy Slen. Her twin girls, Simone and Brielle, were born 8 weeks prematurely.
When the girls were born, I got to kiss them, see them very briefly, and then they were taken straight to the NICU. That was a traumatic experience. You want to have your baby with you after you've been waiting all this time to see them. Fortunately, we knew at 32 weeks they would be able to stay at the NICU at NCH, which we felt very fortunate about.
After their premature birth in an operating room, the tiny infants were whisked away to NCH's Neonatal Intensive Care Unit to be placed in isolettes, incubators designed to simulate the nurturing environment of a mother's womb.
I was sitting there for I don't know how long, for so many days, just watching them breathe and watching them basically develop.
For 17 days, Simone and Brielle struggled to grow, while their mom recovered from emergency surgery. The neonatal team of nurses and physicians administered round-the-clock care, maintaining the delicate balance of conditions necessary for steady development.
And as I was sitting there, I started looking at the bed that they were growing in, and I noticed that there was a nameplate on it with a donation, with an identification of a family. It struck me. This person basically gave the gift of life. And as a parent sitting there, that meant everything.
Around 3,000 babies are born at NCH each year. Of those, about 10% are premature. The Neonatal Intensive Care Unit at NCH averages nearly 11 patients on any given day. Yet the unit has just 9 beds. Currently, the only solutions are an overflow area or transfer to another facility in another city. A dangerous risk for premature infants. Expansion of the NICU is imperative, as important as the life of each tiny treasure.
I always like to look at these kids as almost like an egg without a shell, okay? And as we know, by transferring an egg without a shell, it's very difficult, okay? The last thing you want to do for a baby is to transfer the baby, not only because of the bonding that the role the bonding has with the parents, but also because it's not the right thing to do. I think that the more babies we keep here in Naples, the better.
And there are other reasons for NCH to keep our tiniest treasures in Naples.
The fact that our girls were born here, the fact that we didn't have to go out of town, it means a lot to us. Not only is it a bond with the city of Naples, but it's a special bond with NCH. I can't even imagine looking back, having to go somewhere else, anywhere outside of Naples, anywhere outside of NCH for that day and for that experience. The most important days of our lives were spent right here in Naples at NCH. That's a bond that we'll continue to carry with us for the rest of our lives and for the rest of our girls' lives.
One of the things that I've noticed when I've been in the NICU is just how full that it can be at any one particular time, and the need for a larger facility.
Well, the current NICU is a very small space. It was built many years ago. It's an open-style ward unit. We're doing approximately 3,000 deliveries here at Naples Community Hospital. Yet we have 9 beds. If you look around the country, around the state of Florida, we are probably the smallest NICU, or one of the smallest NICUs, compared to the amount of deliveries.
To keep pace with such growth, NCH has a civic obligation to move forward with expansion plans for the NICU. doubling capacity for high acuity newborns from the current 9 beds to 18. This state-of-the-art facility will provide family-centered healthcare, a model vital to patient improvement. But care in the NICU is not easy on newborns. Development occurs most rapidly when external stimulus is at a minimum, difficult to maintain when a premature baby must be handled at least 3 times a day for warming, weighing, and other care that a conventional incubator cannot provide. Luckily, there is a better way: the Giraffe Bed, an all-in-one neonatal healthcare station. Today, the NICU at NCH has only 1 Giraffe Bed. With such high patient loads, medical staff must choose which premature infant benefits from this new technology, an unenviable decision by any measure. With your donations, we can raise the number of Giraffe Beds to 6. Coupled with an increase in space, these additional beds will well equip the NCH NICU to provide the highest level of care for Naples' growing number of newborns.
I think that the important thing is going to be about actually keeping babies here, those that we can keep here, as opposed to transferring babies out just because we don't have space.
Every time we pass the hospital, that's our home away from home. This whole experience at NCH has really helped us develop our roots in Naples, and we really can't imagine living anywhere else, and this is our home.
Thanks to the NICU at NCH, Dave and Mindy Slen went home in the midst of a happy ending, one made possible through the generosity of a life-sustaining donation. In the end, we all benefit because healthy communities work, especially when we pull together to save our tiniest treasures. From all of us at NCH, thank you.